MRSA and Staph are two different kinds of bacteria that can live on patients' skin, and typically they don't cause any kinds of problems. When patients have open areas to their skin, such as cuts, scrapes, surgical incisions, that bacteria can get into the skin and cause bigger infections. Those infections are sometimes very difficult to treat, and we take those very seriously. They can mean that patients have to take oral antibiotics, sometimes have to be admitted to the hospital to get IV antibiotics, and sometimes have to go back to the operating room to get bigger procedures to remove that bacteria from their systems and clear the infection. There are different steps that we take to prevent that from happening. One of those steps is swabbing everybody's nose to see if that bacteria is living in patients' nostrils. And we use that information to determine if there's any difference in antibiotics that we have to use during the surgery. One of the other things that we do is we give everybody an ointment called mupirocin, and that goes inside patient's nose before surgery to reduce that bacteria as well. We also have our patients shower with certain soaps called chlorhexidine, and that is done 2 days before surgery and then again the morning of surgery to reduce that bacteria that could potentially cause a problem after surgery. We give our patients antibiotics during the procedure itself, and we use the swab that we've done in patients' noses to determine which antibiotics would be best for that patient during the procedure. And then we also put surgical dressings over the incisions in the operating room. And those are done in a clean, sterile environment, and that protects that incision from any outside bacteria or even the bacteria that's normally on our skin that could cause a problem. We take total joint infections very seriously here at Orthopedic Associates of Wausau. If you have any questions about any of the information mentioned or concerns after surgery, please call our office or refer back to the booklet that was given to you prior to surgery.